mask and vaccine mandates as COVID cases, specifically those cases linked to the Delta variant, continue to rise. Will the measures be enough to slow the spread, or will states in the country need to take more drastic measures? Joining us now is Dr. Ulysses Wu, an infectious disease specialist with Hartford Healthcare. Thanks so much for joining us, Dr. Wu. And earlier, we had mentioned in this newscast Dr. Fauci's stance on schools, businesses, and governments mandating vaccines. He thinks it should happen. Is that what needs to happen for life to return to normal?
Well, let's look at the brief period of time that we had some normalcy, right? During the early summer and into the middle of the summer. And that was all really due to vaccines. We were able to go out to restaurants. We were able to hang out with friends. We were able to travel. But unfortunately, the cases are rising now. And so vaccines are part of the solution, and it's part of the long-term solution. But there are temporary measures such as masking, social distancing, hand hygiene, social behavior modification, and so on and so on.
Now, another thing that we're seeing, pediatric COVID cases on the rise across the country, and a lot of these young patients are not old enough to get a COVID vaccine. Some of them aren't even old enough to wear masks. So what is your advice to parents who may be sending their kids to daycare or taking them on play dates? What do they do?
Yeah, and so that really speaks to the volumes of what the vaccine really is. It's really not just about us, but it is about our village. It is our community. It's about creating that bubble to extend that bubble around others. And so the best thing you can do is not put them in situations where it may be harmful to them. And that's the social behavior modification. Short of that, masking and social distancing are most important. But in terms of what is ultimately the most important, it is creating that safe bubble, and that is creating a vaccination bubble for yourself that you can create around your kids.
And the school year, returns just about a month from now. And right now, the governor has not announced any plans to switch back to remote learning. But with these pediatric cases rising, is that something that maybe needs to be reconsidered again?
I think everything's on the table, but if we can do this correctly, so if we can get those who can get vaccinated, and then those who cannot, either masked or socially distanced, I don't see why we would have to return back to remote learning. But it is all dependent on us.
All right, Dr. Wu, thank you so much for your time this evening. We really appreciate it.
Thank you for having me.